Imagine having a disease in which every day is worse than the last. You lose the ability to walk or even sit without muscle spasms. A disease also leading to depression, difficulty swallowing, and thinking in a coherent manner. These symptoms are just some of the many characteristics of Huntington's disease. Huntington's is an autosomal dominant condition, which means if inherited from the parent, the child will certainly be affected, and there is a 50% chance of passing down disease alleles. At a genetic level, the disease is characterized by expansion of the number of CAG replicates within the IT15 gene. This results in enlargement of the Huntington protein, whose function is unclear, but absence is lethal. A normal person has less than 27 CAG repeats. When the repeat number is between 36 and 39, disease phenotype may still be observed, but with reduced severity. When the repeat number exceeds 40, Huntington's disease is observed. Huntington's results in progressive degeneration of the neuronal cells in the brain, which subsequently causes functional impairment in motor, cognitive, and psychiatric domains such as decision-making and motivational centers. The average age for disease onset is 38, though a greater number of CAG replicates is directly correlated with earlier age of onset. In approximately 5% of Huntington's cases, clinical symptoms may appear before the age of 20. The progression of Huntington's disease can be delineated into 3 stages. The first stage is pre-symptomatic, where no signs or symptoms are present, but at a physiological level, changes may have already begun to occur, for example, signs of neuronal cell death. The second stage is known as prodromal. In this stage, there are some subtle signs and symptoms present. People in this stage may be suffering from depression and apathy, among other behavioral changes, which are often misdiagnosed as psychiatric if no family history of Huntington's is available. The third stage is manifestation. In this stage, there's a slow progression of motor and cognitive symptoms, such as problems with coordination or rigidity of movement, twitching, weight loss, and slurred speech. Progressive worsening of symptoms include muscle loss. There is no cure for this debilitating disease. However, there is a single FDA-approved drug, tetrabenazine, which aids in alleviation of motor problems such as chorea, constant movement, and reduces neuronal loss in the brain. However, the drug is also correlated with worsening severity of depressive symptoms in many patients and is not effective for disease prevention. Current therapeutics that are being researched focus on a mechanism known as allele-specific suppression. The goal of this approach is to identify unique characteristics of the expanded Huntington's gene without affecting the healthy Huntington protein. Researchers have developed a humanized Huntington's mouse model, meaning that the mouse has cells and tissues that function like humans, and they were able to show that oligonucleotides could effectively target the expanded allele in the neurons, decreasing disease Huntington's expression without targeting normal Huntington's protein. However, some challenges with this methodology is safe delivery to the target tissue, such as the brain, without affecting other cells. This study has not yet progressed to human trials, which will also require optimization of proper treatment protocol. The most novel drug therapy was published in various news articles in late 2017. This therapeutic involves the injection of a drug known as Ionis HTTRX into the spinal fluid, with the goal of lowering toxic protein levels in the brain. This method of delivery surpasses the challenges of crossing the blood-brain barrier. The 46-person trial has demonstrated that Ionis HTTRX successfully lowered the harmful Huntington protein in the cerebrospinal fluid. Furthermore, they showed that the drug is safe, providing potential for future treatment. Therapeutics are showing promising results in mouse models, which will ultimately and hopefully lead to new and beneficial human trials. Thank you for watching. For more information about Huntington's disease, please visit www.huntingtonsociety.ca.